Hello, friends. I'm Jamie Swartz, a lifestyle medicine physician and registered yoga teacher. Today, we'll be talking about the physiology of fibromyalgia and yoga's healing potential. Let's imagine for a moment waking up every day feeling like we run a marathon in our sleep. Our muscles might be achy, our mind might be foggy, and even a gentle hug might feel like too much. If you're currently navigating fibromyalgia, or FM, this might sound all too familiar. It's a condition that turns everyday life into an uphill battle. Today, we'll explore physiology of fibromyalgia, what's happening inside the body scientifically, and how yoga, backed by evidence-based research, can help soothe those symptoms. We'll weave in some faith-centered encouragement, drawing on God's promises of comfort and renewal. And importantly, we'll cover precautions to start safely. Let's step forward with grace and hope. First, let's break down the physiology of fibromyalgia in simple terms. FM, or fibromyalgia, is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive issues like fibrofog, as you may have heard it called. It's not just muscle pain, it's a central nervous system glitch. Think of your brain and spinal cord as an amplifier. They may be cranking up your pain signals far beyond what's normal. A process called central sensitization. Normally, pain protects us from harm. But in FM, the nervous system becomes hypersensitive, turning minor sensations into major agony. This involves neurotransmitters like serotonin and norepinephrine being out of balance, leading to an amplified pain processing in areas like the brain's insula and anterior cingulate cortex. Adding layers on top of this, there's often low-grade inflammation from elevated cytokines, those immune messengers that keep our body on high alert. Oxidative stress plays a role too, where free radicals damage cells, contributing to fatigue and pain. Mitochondria, our cells' little energy factories, may not be working efficiently, explaining the profound exhaustion that rest just doesn't fix. Sleep is disrupted because FM affects our autonomic nervous system, causing unrefreshing rest, mood swings, and possibly even gut issues. Genetics, infection, trauma, or stress can trigger FM, but once underway, it can be a cycle of pain, feeding fatigue, feeding more pain. This can feel complex, but understanding it empowers us. In this storm, God offers us an anchor. As Psalm 34:18 assures, the Lord is close to the brokenhearted and saves those who are crushed in spirit. God sees our struggles. He invites us to lean on Him for strength beyond our own. Our body, though weary, is a temple that He is actively restoring. So, you may ask, how can yoga, a blend of mindful movement, breath, and presence, help interrupt this cycle? I'm glad you asked. We can try gentle, adapted practices like restorative forms. Research shows us how yoga and gentle stretching with mindful breathing and meditation can be a safe, effective complement to treatment, targeting FM's core issues. Let's talk about the evidence. A randomized controlled trial on an 8-week mindful yoga intervention found significant improvements in pain, fatigue, stiffness, and coping abilities for FM patients. Participants reported better sleep and reduced depression, with effects lasting up to 3 months post-program. Isn't that amazing? Another study on daily gentle yoga showed decreases in average and worst pain ratings, plus less fatigue and better sleep quality after just a few weeks. Amazing. Yoga can even reduce pain catastrophizing, that spiral of negative thoughts about pain. A broader review confirmed that yoga improves mood, anxiety, acceptance, and overall quality of life in FM. Why? Well, yoga activates our parasympathetic nervous system, lowering our stress hormones like cortisol, and reduces inflammation. This boosts our endorphins, those happy transmitters in our brain, and GABA, which are natural pain relievers, while gentle postures can enhance our blood flow to muscles, easing stiffness without overload. Pilot studies comparing yoga to structured exercise found that yoga was superior for pain reduction and shifting unhelpful pain beliefs. It is truly holistic, healing body, mind, and our spirit. It's so amazing. I love it. From a faith view, yoga can be prayer in motion. As we breathe gently in child's form, we can surrender our pain to God, echoing Matthew 11:28. God says, "Come to me, all you who are weary and burdened, and I will give you rest." This is a way to honor our body as God's creation, finding peace amid our aches and pains. Before we get started on this journey, there are a few precautions that are key to avoiding flares. Make sure you consult your doctor first, especially if you have other significant medical conditions. You may want to begin slowly, only 5 or 10 minutes a day with gentle styles like restorative or chair yoga. I encourage and invite you to use props like your bed, pillows, chairs, walls, bolsters, even blankets and blocks for support and comfort. Listen to your body. Stop if your pain sharpens and avoid long holds or intense poses until strength builds. Start with breath work to calm the mind and journal how you may be feeling to track your triggers. Remember, this is not about perfection. It's recognizing our progress, one practice at a time. Let's review. Fibromyalgia can amplify our pain through central sensitization and systemic imbalances. But yoga's evidence-based benefits, easing our pain, boosting our mood, and improving our sleep, offer real relief. With precautions and faith's encouragement, we can move toward healing. You are resilient, gently, and lovingly held by a God who renews the weary. Thank you for joining me today. I hope to see you again soon. May God's peace envelop you today.